In this video, I'm going to discuss different forms of hypoxemia, and then after that discuss which of these forms of hypoxemia will affect the AA gradient. So the big A stands for alveoli, while the small a stands for arterioles. So AA gradient will tell you the oxygen difference between the partial pressure of the alveolar minus the partial pressure of the arteriole, and that would give you the AA gradient. Now the question is that with all the different forms of hypoxemia that I've listed down there, which of them will have a normal AA and which of them will have increased AA gradient? So the two conditions that will have a normal AA, so alveolar, arteriolar partial pressure of the O2 does not change, are high altitude and hypoventilation. So with both of these conditions, since there is a proportional decrease in both the alveolar as well as the arteriolar partial pressure of O2, therefore the AA gradient remains the same. While with the rest of the conditions that I will discuss later, there would be an increase in the AA gradient. So with the first condition, at high altitude, we have an increased partial alveolar pressure of the carbon dioxide, as a consequence of which there would be decreased partial alveolar pressure of the oxygen. And so since now we have a decreased partial pressure of oxygen in the alveolar, therefore there would be decreased level of oxygen that would also diffuse the arterioles. So therefore there would be decreased arteriolar oxygen partial pressure. But since there is a proportional decrease in both alveolar and arteriolar partial pressure, therefore AA gradient remains constant. Similar concepts applies to hypoventilation, where the AA gradient remains constant, and conditions that can cause hypoventilation includes, for instance, CNS depression, which could be, for instance, from opioid toxicity. It could include, for instance, the Guillain-Barré syndrome, where there is problem with the muscles of the chest wall, as a consequence of which patients cannot ventilate, and so it will cause hypoventilation. Or sometimes there is mechanical problem with the chest wall, like for instance kyphoscoliosis, as a consequence of which there would be a problem with the respiration. But again, there would be a proportional decrease in both the alveolar and arterial partial pressure, and thus the AA gradient remains the same. Now with the other three conditions that I've listed here, the AA gradient will increase. So with the first one, there would be a ventilation perfusion mismatch. So in the lungs, the level of normal ventilation to perfusion has been disrupted. For instance, with the ventilation, patients that have obstructive lung disorders, like for instance they have asthma, will have low ventilation. Or on the other hand, if there is a problem with the perfusion of blood in the lungs, like for instance from pulmonary embolism, then there would be low level of perfusion. And so with both of these conditions, the AA gradient will be disturbed. With the right to left shunt, blood passes from the right side of the heart to the left side without being oxygenated. So this is also another form of VQ mismatch, because blood does not perfuse the lungs, as a consequence of which again there would be increased AA gradient. And then finally, conditions that limit diffusion of oxygen across the alveoli, like for instance pulmonary edema, or interstitial inflammation, or for instance lung fibrosis, will again increase the AA gradient. And that concludes the topic of different forms of hypoxemia and their effects on the AA gradient.